In this video, we'll learn about tracheoesophageal fistula. These are of 5 types. One is atresia without any fistula, and second one is with the proximal fistula, distal fistula, and the proximal and the distal fistula. And the last type is there is no atresia; it is only head-shaped tracheoesophageal fistula. Right? So 5 types. One is without fistula, and the last one is no atresia, but it is an H-type TEF. Right? And the other three are proximal, distal, and the proximal and the distal. So it is associated with vector syndrome. So which includes this vertebral defects, anal atresia, cardiac defects, tracheoesophageal fistula. The TE stands for tracheoesophageal fistula and the R for renal agenesis. So anal atresia, cardiac defect, tracheoesophageal fistulas and the renal agenesis along with the vertebral defects. So these are the vector group of syndromes which are associated with the tracheoesophageal fistulas. So what will be the clinical symptoms? There will be maternal hydroamnios and the baby regurgitates all the feeds. So this is important to write in the exam. The baby regurgitates all the feeds and there will be continuous pouring of the saliva through the mouth and you cannot pass the NG tube into the baby, right? So the baby even coughs and cyanosis can be seen. Right, because there is a fistula between the trachea and the esophagus, so the food will be not passing through the esophagus, it will be regurgitated, and also there will be continuous pouring of the saliva, and also you cannot pass the NG tube because you cannot pass the NG tube to the esophagus because there is a fistula at this level, right? So on the diagnosis you can take the clinical history where they'll give the signs of all the regurgitation of the feces, continuous pouring of the saliva, and also you can take this X-ray to see this NG tube which is not passing through the esophagus. Okay? Contrast esophagiogram and bronchoscopy, antenatal USG can also be done because it is associated with other vector group of symptoms, right? So you can do USG in the antenatal period itself. So what will be the treatment? Treatment will be feeding gastrostomy through the right thoracotomy, right? So feeding gastrostomy through the right thoracotomy. So you identify the fistula and then do resection and anastomosis, right? So identification of the fistula, then you do resection, lower segment anastomosis to the upper segment. So what will be the complications? Because of the frequent regurgitation of all the feces, there will be reflux, esophagitis and acid reflux and also pneumonia, right? So this is a picture of all the 5 types. So first one you can see this atresia without any TF. So this is the first one, atresia without any fistula. And the last one is no atresia but there is H type. So this is the H type which you can see, right? So here there is no atresia. So first and last type is done, and the other 3 types are proximal, distal and the proximal and the distal. So here you can see this proximal TF, that means only the proximal one, you can see the tracheoesophageal fistula. And here you can see the distal one. So in the distal region you can see tracheoesophageal fistula. In this picture you can see this proximal and the distal, right? So there will be proximal and the distal. So these are the 5 types of tracheoesophageal fistula. Also, if you want to buy the surgery PDF which contains all the important questions for university exams which I have made using SRB, Marrow and other resources, contains all the diagrams and all the important points which you have to mention in the exam. So if you want to buy it, you can text me on the Telegram. Bye.